Well, hello everybody and welcome to this presentation. My name's Dr. Sarah Lloyd, and over the next 15 minutes I'm going to be sharing with you some recent findings from research conducted by PACE. PACE stands for Parents Against Child Exploitation. The research explores parents' experiences of the children's social care system when their child is being sexually exploited. So why did PACE want to conduct this research? Well, PACE has been working with families affected by child sexual exploitation for nearly 25 years now. And over that time, parents and carers have consistently reported to staff that they've had problematic and difficult relationships with children's social care. And it seemed timely at this point in PACE's journey that they should explore these experiences in more detail. So how? What was our methodology? Well, the research was qualitative and there were 32 parents that took part. 20 were interviewed over the telephone through semi-structured interviews and 12 took part in 2 focus groups. The parents had all had contact with PACE between 2016 and 2018. When the data was collected, it was thematically analysed and written up, and I'm going to share those findings with you now. So the research questions we had were, number 1, what response do parents and their children receive from children's social care services? Number 2, what is the impact of that response on the safeguarding of their child? And number 3, what would make things better for parents and their child? So what we found was that most parents approached children's social care when they realised that their child was being sexually exploited with expectations. They were optimistic. They wanted support, they wanted help from children's social care. So this parent says, I was in total crisis in this unknown world, fighting to keep my child safe. I'd hoped that social services would help and support me. I needed to feel safe. So what was the response that parents got once they've made that approach? Well, a number of things came up. There was a delay. There was a lack of understanding about child sexual exploitation. Parents felt blamed, they felt unlistened to. There was a lack of engagement with children's social care, and they commonly reported what a difference it made when they were shown compassion. So let me unpack that for you a bit. So the first one, delay. This was a common issue for parents. Most commonly 3 months was the waiting time that parents had from referral to a strategy meeting or an effective response from children's social care. But some parents waited any time up to 2 years. And that delay had devastating consequences for them and their child because, of course, the exploitation continued and their child was at extremely high level of harm, experiencing a lot of harm. So this parent said it took years of extreme pressure from us and other professionals for children's social care to become involved. During that time, my daughter was being abused and there was the ongoing risk of death as my daughter made numerous suicide attempts. The abuse went on far too long and became far too extreme before anything was offered. Parents reported a lack of understanding from children's social care. They felt that the abuse of their child was minimised, that the extent and level of harm their child was experiencing was simply not recognised, and that CSE wasn't really taken seriously. And that was due to social workers not really understanding it. So this parent says, even when that attitude shifted and children's social care became involved, the focus wasn't about my daughter being raped and sexually exploited or the people doing this, but on my childhood and parenting. Not being listened to, another key theme in the data. Parents felt they were not heard. They weren't consulted, they weren't kept informed, and they were viewed essentially as being part of the problem, not as part of the solution. So this parent says children's social care say that they want families involved, but they want you to attend meetings and stay silent. They didn't like me trying to be part of it. They just had this approach that everything was happening because of me. Nobody told me anything. And this left parents really feeling on the outside of everything. Many of the parents reported feeling that social workers didn't engage with them or their child effectively. They didn't understand or appreciate the impact of trauma on the child, on the family, on siblings, And also that they were quick to close down their child's case, which was really difficult and not appropriate. So this parent said, there was no attempt to engage my son. There is no understanding of how young people who are controlled and traumatised may act, and there was no support for him. The next thing was probably the most significant that we found in the data: parents feeling blamed. Many of the parents reported that they felt children's social care main focus was on parental failure. How had these parents failed so much that their child had become vulnerable to sexual exploitation? And this was devastating for parents, that feeling of being judged. They felt social workers focused overwhelmingly on the need for parental change above everything else, and this meant there was little or no attention they felt on the perpetrators. This parent says, I was treated like a perpetrator. Everything about my parenting was questioned, and there was no focus on the dangers to the child. Some parents did report a positive experience of children's social care, but they were in the minority. The ones who did said that persistence and consistency had been vital, that when they'd felt genuinely cared about, it had been invaluable, and that when social workers' interventions went above and beyond, it had made such a difference, and often changed the direction in which their child was heading. So this parent said, when we got a worker who really cared about my daughter and me, everything changed for us. My daughter is rebuilding her life safe from abuse. So, second research question, what was the impact of that response? What was the impact for parents of feeling blamed, of that delay, of that lack of understanding? Well, the vast majority of the parents we spoke to reported that they would never seek help from children's social care again, and they would dissuade other parents from seeking help. Only 12.5% of parents reported that children's social care had actually helped them. The majority said the situations they were in were made worse, not better, and that the relationship with their child had actually been negatively affected by the ongoing situation and problematic situation with children's social care. These parents say the involvement of children's social care damaged my relationship with my child. Excuse me. I think if my child and I had been less strong, it would have destroyed us. This parent says it was like walking into a war zone with unexpected traps under the rugs. I was on high alert because of what was happening to my child. I needed to feel safe, but children's social care wasn't safe to speak to in the midst of crisis. The language of war might seem quite melodramatic, but what we actually found in the data was that the language of battle, of war, even of torture, was very common. Parents felt they had a battle on their hands on all fronts, from the perpetrators and from children's social care. And the impact of that really can't be understated. It was devastating for them. So the third research question, what parents said would help? And there were 5 elements to this. Parents wanted to be viewed as partners. They felt social workers would benefit from more training. They wanted an earlier response, quality relationships, and multi-agency coordination. So parents as partners, what does that mean? Well, this parent said a huge difference and improvement for families would be children's social care changing to see parents as the solution rather than the problem. And as PACE always says, unless proven otherwise, the parent should be seen as a strength, not a deficit, and work with together in the safeguarding of their child. And in many cases, the parents are actually the child's greatest asset. And therefore, parents suggested that they would really be like children's social care to stop seeing them as part of the problem who require fixing. Better training, this came up again and again in the data. Parents would like social workers, whether it's in university or as part of their ongoing training, to have a better understanding of the indicators of child sexual exploitation, to have trauma-informed practice training, so they can understand the impact of trauma and how that impacts the child and the impact on the family, including siblings. They think social workers should have training on how to de-escalate conflict and in turn pass that training on to parents. And a much deeper understanding about how child sexual exploitation of a sibling affects other siblings in that house and how devastating that can be. Earlier and more creative responses. As we've already said, many of the parents found the delay in response to them devastating, and indeed it meant that their child was abused for much longer. So parents would like an immediate response when their child is referred, in an immediate response to their child's needs and their needs, quick access to resources, and the ability for social care and others to recognise the need to disrupt perpetrators as quickly as possible. And that earlier and creative response and disruption of the perpetrator and quick access to resources can mean the difference between their child being raped and not raped, trafficked and not trafficked, going missing and not going missing, living and dying. It really is that serious. Good quality relationships. So this parent said, the social worker built a good relationship with me where I felt comfortable and could be open. She was so compassionate, and if I needed to cry, I would, and she'd be so supportive. She made sure I understood the processes. So for this parent, having a social worker who she felt she could trust, who she could be upset with, angry with, and not be judged for that was a huge benefit. So establishing trust early on between parents and social workers and the child, and being persistent and consistent, was cited again and again as being so important. Showing genuine care, genuine kindness, and really developing that relationship as quickly as possible can make such a difference. Better multi-agency coordination. Again, this came up repeatedly. The need for different agencies to share information and work together and include parents in that. So this parent said there needs to be a shift towards a model of contextual safeguarding where the risks are identified in different areas of the child's life and there's a coherent multi-agency response. So better information sharing, disrupting the perpetrators and meeting the needs of the child and identifying risks early on. And that involves health, education, police, and many more besides. So to conclude, early intervention was seen as absolutely vital and rarely happened. Parents should be treated as partners and not the enemy and work with together in the safeguarding of their child. Social workers need to show genuine care and kindness to parents and the child. And within that, as I mentioned, came up repeatedly the need to not blame parents for the exploitation of their child, but blame the perpetrators. That approach would make such a difference to parents. And again, effective multi-agency working, everyone working together to try and safeguard the child and disrupt the perpetrators was seen as vital. If you would like to access this full report, you can do so at the PACE website, the information of which is at the bottom of this presentation. And if you require any support for yourself or somebody you know, please do contact PACE. And thank you so much for listening. Bye-bye.